Hello class, this is Dr. Amira again. This is physical agent modalities and we've made it to slide number 20 for paraffin baths. Oh, 22, sorry for that. Okay, so paraffin baths are a superficial agent modalities and by now we know those are modalities that are literally skin deep, so they do heat superficially. In this case, paraffin is one of those modalities. The top picture here shows the dip method, where you dip an extremity, in this case an elbow. You can dip the hand. Dipping the hand or dipping the foot is another way to do that. You could use a brush to brush that on, or use a cup to pour this if this is an area where you need to apply the paraffin on an area you cannot dip. uh, if you're trying to do it on the shoulder, for example, or the back of the neck, etc. So you could do that. The purpose of the paraffin is to delivering heat, again superficially, effective in areas which are difficult to heat. Uh, sometimes the hands are harder to heat with the hot packs, or the feet. In addition to the effects of the superficial heat, like we've talked about hot packs, paraffin it retains the perspiration really well. So the sweating that we sweat, it's retained there, and it will soften the skin. There's also a lot of times there is mineral oils that are infused into the paraffin, so that will uh, moisten the skin more than the regular hot packs. Temperature of subcutaneous tissue are increased by heat conduction from superficial tissue. So in the case of the hand, for example, because everything is almost superficial, you heat the skin, you will most likely heat some of the tendons, or the pulleys of the tendons, or obviously the blood vessels in the hand. Other than that, it is still superficial heating modality. Advantages are especially useful for distal extremities, like we said, the hand, the feet, the elbow, areas that you can dip. Paraffin has an oil mixture that helps soften the skin. Disadvantages, some people might find the heat to be excessive. It's about 125 to 127 Fahrenheit degrees Fahrenheit, and some people might feel that it's too hot. Temperatures of the bath cannot be lowered without solidifying the wax, and that is a disadvantage. Unlike regular hot packs, where you can add a towel, in this case you can't. If you bring the temperature down, the wax will start getting cold. Treatment with liquid paraffin can be messy, and that is true from personal experience. So try not to get the wax on people's clothes or shoes. You have to drape the clients really well before you dip their hands in paraffin. Otherwise, you might ruin their fancy shoes or clothes or purses. So just be careful with that. It can be messy. Um, Movement must be minimized in paraffin baths. And I've seen therapists who would ask the clients to dip or exercise, put their fingers in the paraffin and move them around, or exercise. You are not supposed to do that. You're supposed to just dip the hand and take it out for a few seconds and dip it again without moving, so you don't create air bubbles that will act as an insulation between the skin and the paraffin. So movement must be minimized in paraffin baths. It's used for subacute and chronic inflammation, just like hot packs again. Uh, for example, arthritis is a classic condition. Chronic arthritis, you could use uh, paraffin bath for the hand and the feet. It's very effective. Contraindication, it is contraindicated in cases just like commercial hot packs. And those would be if the clients have fever, cardiac issues, like we've outlined earlier, clients with peripheral vascular diseases, for example, malignancies, etc. And in this case, on top of the hot packs, You can also, contraindication, it is contraindicated if the patient has an open wound. So open wounds, obviously, to minimize infections and cross infections with other clients who will be dipping their hands in the same paraffin bath in the future. So we should not uh, use paraffin. Precautions are, again, just like hot packs. It's contraindicated for people who are elderly, people who have poor sensation, and such. So double check on the precautions we've spoke about earlier. Instructions. There are several methods of delivering paraffin baths. Most people use the dip method, where you dip the extremity, dip the hand or the foot or the elbow. Um, we've used the brush, where you can brush it on the client, for example, if you need to moisten around the biceps or the forearm and you cannot dip that forearm, you could use a brush. You could use a small cup to scoop the paraffin and pour it on an area that are hard to dip. Instruct the patients what to expect from the treatment. You can tell them it's going to be warm. It's going to, we're going to do this. Don't move your hand. Don't move your fingers. We're going to dip it 3 times, 4 times, whatever. Check the temperature of the bath. It needs to be 125, 127 degrees Fahrenheit degrees, about 52, 53 Celsius. Wash the part before and check for skin integrity always. Position the patient comfy and drape and keep paraffin off their clothes. Instruct the patient to dip and remove, usually 6 to 8 times. You dip it, take it out, take their hand out, and allow the paraffin to be a little bit firm, and then you dip it again. Once you're done, you have to wrap the extremity, the hand, in a plastic. There are plastic gloves you could use. You could use saline wraps that we use for food. You could use a grocery bag, but it's ideal to put it in a plastic uh, bag of some kind. And then you put a towel on top again to retain the heat. You let it sit there 20 minutes, and then you remove the paraffin, peeling it off gradually. And then after that, you dry the part, dry the fingers, between the fingers, the toes, etc. And you have to discard the paraffin. Do not put it back in the paraffin bath. So again, cross contamination. You don't put that paraffin back. You have to discard it. What I normally do is have my clients use that as an exercise modality. They can roll it, they can pinch it, they can use their fingers to draw, you know, do something with that paraffin bath. Spread it on the table and have the patient use their fingers to exercise or, poke at it or do something with it, and then you throw it away after that. So use that paraffin as a craft, so to speak. And then you continue your treatment as indicated. If you're doing slow passive stretch to the fingers because there's limitations in the flexors, or if you're doing whatever you're doing, continue your treatment as indicated. Next, we will talk about cryotherapy in the next section.